Malaria can cause serious concerns for moms-to-be, especially when these moms-to-be are located in malaria-prone regions. In this video, we are going to be looking at what malaria is, how can it impact pregnancy, can malaria cause miscarriage or any other complications during pregnancy, how to prevent malaria during pregnancy, and helpful safety tips for those moms or moms-to-be who live in malaria-prone areas or are traveling to malaria-prone regions. Now make yourself comfortable. Let's dive into the video. Hello and welcome once again aboard JulieCity. How are you keeping? I hope you're keeping well and safe. Thank you for clicking to join today's video. You're highly appreciated. So malaria can be very concerning for expectant moms or moms-to-be. This topic was influenced by a question I got in one of my recent videos. So I decided to make this video in order to provide clear, evidence-based information in order to reassure and inform. It is always important to contact your midwife or doctor that is looking after you in pregnancy for specific information and care. Understanding the risk associated with malaria during pregnancy and methods of prevention is vital to the well-being of mom and unborn baby. From the sound of that question left for me in my most recent video that influenced the video, I assume that this person is from Nigeria. Now, don't fret, I'm Nigerian. I got pregnant in Nigeria, had my babies in Nigeria, so I'll bring it right home. I have had malaria myself several times and I've been treated with malaria. So I'm going to be talking about this topic as something that I've experienced and something I know a bit about, not just as a professional, but also as a person from a malaria-prone zone. Now, growing up, we are told that mosquito causes malaria. But I want to start by saying that mosquito is not the problem. However, an infected mosquito is the problem. A mosquito that has been infected by this specific parasite, when it bites a pregnant woman, the chances of that pregnant woman having malaria is high. So not all mosquito that bites a person gives the person malaria, only the infected one. Then the big question becomes, how do we determine which mosquito is infected or not? Please leave your comments in the comment section. Let's continue. So, during pregnancy, a woman's immune system is naturally suppressed or lower than an, I'll put in quotes, unpregnant woman, than a person that is not pregnant. So when this pregnant woman is exposed to an infected mosquito, the chances of getting malaria is high. So we can now say that malaria is caused by a parasite that can infect mosquitoes. And when that infected mosquito bites a pregnant woman, it can lead to malaria. Now, the main question that was asked is, can malaria cause miscarriage? Before I answer that question, I want to remind you once again, the essence of this video is not to scare anyone. It's not to cause any anxiety. However, it is to provide clear evidence-based information in order to provide reassurance and education. So the answer to that question, according to research, is yes. There is a risk of malaria causing miscarriage. This lady went on to state that her doctor told her that the loss she experienced was as a result of malaria, and my sincere condolence to her. So, how does that happen? Now, like I said earlier, I grew up and had my own babies in a malaria-prone environment, and I know tons of people who had babies, are having babies, will have babies. But then I also know a lot of people who have had miscarriages without any explanation. So yes, according to research, malaria can increase the chance of miscarriage. Like I said earlier, pregnancy naturally causes a woman's immune system to be suppressed or lowered, which makes her more vulnerable to infection. Malaria is also an infection that is caused by a parasite. So when this infection comes into a pregnant woman's body, our bodies do rise up in the case of infection to defend us, and that's what we call our immune system. Now, like it will naturally do, it will rise up to fight against infection. And in some cases, in the case of a malaria infection, this reaction of our body to defend us might be inflated, therefore causing more harm than good. So if it overreacts, which is what we call inflammation, might cause a damage to the placenta, which might disrupt the pregnancy process, possibly leading to pregnancy loss. Also, from another school of thought, it was documented that our bodies, in the process of reacting to fight against this malaria infection, might trigger a hormone, which is the prostaglandins. I will leave it on the screen. And that is literally the hormone that incites labor. And when this happens, obviously, labor commences, especially when it's in the early stages of pregnancy. There might result in miscarriage or pregnancy loss. It is therefore vital, like I will always say in my videos, if you feel anything unusual, make sure you contact your doctor. Depending on the phase of your pregnancy, consult your midwife or doctor that is looking after you in pregnancy. Now, we know that malaria has symptoms. Fever is one, chill, general unwellness. So in pregnancy, as soon as you feel anything different, anything unusual, any signs of fever or anything at all that makes you feel concerned, consult your midwife or doctor looking after you in pregnancy, because as the saying goes, a stitch in time saves 9. And from one of my videos, I'll also borrow another phrase that I heard from the train station: see it, say it, sort it. In doing this research, I also found out that not only does it lead to miscarriage, apparently if prostaglandins triggers labor and that pregnancy is not yet term, that is classified as preterm labor or premature labor. So there is a risk of having miscarriage or preterm labor with malaria. It is also noted that malaria can cause maternal anemia. It can lead to low birth weights and, worst of all, stillbirth. Like I said, this video is meant to provide knowledge, and knowledge is empowering. Prevention of malaria and early detection is therefore paramount during pregnancy. How can malaria be therefore prevented, especially for a person who lives in a malaria-prone area? Of course, basics is make sure you protect yourself. In the market, there are a few things now: creams, insecticides, wearing protective clothing, long sleeves. If you're sitting outside or exposed to an area where you feel there's mosquito, then use them. If you're unsure of any of these products, consult your pharmacist, consult your midwife or doctor looking after you in pregnancy before using them. Of course, you also take into account if you have any other medical condition like asthma, using a coil, a mosquito coil. If a pregnant woman has asthma, caution will be required in order not to trigger an asthmatic attack. Knowledge is powerful. Wearing protective clothing is key. Keeping your environment clean is also vital. No puddles or ponds of water, dirty water that might attract them. No rubbish bins that might attract mosquito. When it is getting to evening time, make sure windows are closed. You can also, I know a lot of my people, my relatives, they have mosquito nets on their windows. So If it is possible to do that, put mosquito protection guards on doors, on windows, and keep them closed, especially when it's getting to evening time. Using mosquito nets over your bed is a great way to prevent being bitten by mosquito during pregnancy. Most of all, attending your antenatal appointment religiously is vital to your well-being and the well-being of your unborn child. The chances of getting malaria in a malaria-prone area is high. So, if you're prescribed any anti-malaria, take them. I will also use this opportunity to sound a warning. If you're pregnant, please don't just get an over-the-counter malaria medication. Contact your doctor looking after you in pregnancy, or even your midwife to guide you in the choice of anti-malaria medications to take during pregnancy. That is because not all anti-malaria medications are suitable during pregnancy. When your anti-malaria is confirmed or your malaria treatment medication is confirmed, please take it religiously as prescribed. Hopefully, this will protect you so that even when you get bitten by an infected mosquito, it will have little or no impact on your unborn baby. If you're pregnant and you're living outside of a malaria-prone area or zone or region, then the best advice as a healthcare professional will be avoid it. But some of us, we have links in some of these areas that it might be essential to travel back to the place we call home. So the best travel tips will be then to make sure before you travel as a pregnant person to a mosquito-prone region, consult your doctor. There are anti-malaria medications that are suitable for during pregnancy. You might need an immunization. Your specific healthcare provider, your doctor or midwife, will be able to advise you specifically based on your own unique needs. So consult your midwife or doctor before traveling to those areas. In recent times, I have heard about wristbands. So make your own research to find out other alternatives or extra measures that you can take to prevent yourself from getting infected by malaria. Things like wristbands, there are certain creams, repellents, and of course your prescribed medication. All of these will help reduce your chances of getting infected by mosquito if you're traveling to a mosquito-prone area. Be vigilant for symptoms of malaria and at any cause of worry, fever, chills, flu-like symptoms, runny nose, general feeling of unwellness, consult your doctor immediately. In summary, I will say that while malaria can be very concerning during pregnancy, acquiring knowledge like this, so thank you for clicking to watch, and following relevant and prescribed prevention methods does help greatly to reduce the impact of malaria during pregnancy. So be vigilant. When you see it, say it to your midwife or doctor and it will get sorted. I hope you found this video useful. I'll appreciate your view, your comments, and your own specific stories in the comment section. Remember to like this video, subscribe if you have not, and share this vital information to others who will benefit from it. Until I see you in my next video, remember, your health is your wealth. Bye-bye. Don't forget to click on these videos popping up. I'm sure you find them insightful.